Hello, magandang umaga sa lahat. Ngayon, atin namang tatalakayin another drugs, medications, pharmacology tayo. Halika, aralin natin. We have trimethoprim, sulfamethoxazole, and pyrimethamine sulfadiazine. No? Basically, sulfa drugs at saka anti-folate natin na medications. Okay, ngayon. So, ito sa mga mahihirap no, na mga gamot na pag-aralan in pharmacology, but let's try to study this and as possible ma-retain siya no in a way na di madaling makalimutan. So in this picture, ulit muna tayo. We have here a panda, right? A panda bear na so trick or treat ito na situation sa comics, trick or treat, Halloween, naka-panda bear. Ito may naka-bamboo na costume, mga bata na na mga ghosty. Ito corn kernel. May duguan pa dito ng camera, may doktor, may devil na attire, may fox. Yan, may naka-costume pang iba, di ba? Naka-pyramid na hat. Ito may pa, may pusa. Tsaka ito matanda. So kung tatandaan natin yung pag matanda, di ba, immunocompromised yan. Ito namang ping-pong yan yung pneumocystis carinii natin, pneumonia, di ba? Yung sa microbiology natin na pinag-aralan, di ba? Yes, of course. Ito, nocardia, di ba? Ito yung illustration natin sa nocardiosis sa microbiology natin. Pag no mercy, MRSA. Pag wolf, di ba, SLE and wolf. That is for fox, pala yan, fox or wolf. Systemic lupus, lupus erythematosus, yun yung symbol natin. Pag pusa, toxoplasmosis, di ba? Pag itlog, sulfa yan kasi parang di ba? Pag sinabing rotten egg, that's the smell of our sulfur, di ba? Rotten eggs for sulfur. Ito naman, magagamba, teratogenic. So, yan, okay, simulan natin ulit. So, pag sinasabi natin TMP, SMX, kung titingnan nyo dito, SMX, TMP, yan po yung trimethoprim, sulfamethoxazole natin. Diba? Ito si Panda, this would remind us about PABA. PABA is your para-aminobenzoic acid. Si Panda natin, that is the intermediate for folate synthesis. Ito yung steps natin sa folate sa DNA making. PABA is Panda, that's the representative for our PABA or para-aminobenzoic acid, intermediate in folate synthesis. So kung makikita nyo yan, may hawak itong Panda natin na di ba yan yung formation ng mga purines natin? Yeah, purine. So purines. So this is the step of that PABA, no? The beginning of the folate pathway para gumawa ng purines. Pagkatapos ng purines, in combination with pyrimidines, gagawa ng nucleic acid or sample DNA, di ba? So ito, PABA to purines. Yan. Ito namang may dalawang dito, may dalawang dahon at saka dito 4. So this would be our dihydrofolic acid. Di means 2, ito tetra, 4, tetrahydrofolic acid. So 2 leaves, ito 4 leaves. So from PABA to dihydrofolic acid to tetrahydrofolic acid, di ba? So eventually, ito po yung steps natin sa anti-folate natin na medications na tinatamaan. So sulfamethoxazole, it hits the panda bear. So meaning it would stop or inhibit the formation of your it would stop the formation of your dihydrofolic acid. Itong tinamaan si Panda, di ba? Again, by inhibiting dihydrofolate synthase. Yes, dihydrofolic synthase. Yun yung enzyme na that will help in the formation of dihydrofolic acid. So from PABA, para-aminobutyric acid, then going to dihydrofolic acid. So again, what's the enzyme that is inhibited by your sulfamethoxazole? That is your dihydrofolate synthase. For the formation of your tetrahydrofolate, From dihydrofolate, ang tawag doon, the enzyme used for that is dihydrofolate reductase. Yun naman yung action ng yung TMP natin. Yes, that's the action of the TMP that inhibits dihydrofolate reductase. Kaya yan tissue, that's our symbol for trimethoprim or TMP, trimethoprim, or your tissue high again that inhibits our dihydrofolate reductase. Again, SMX for inhibition of dihydrofolate synthase, while your TMP inhibits dihydrofolate reductase, preventing the formation of your tetrahydrofolate or tetrahydrofolic acid. So basically yun yung action natin sa SMX at saka sa TMP natin. Okay? So these medications, ito nakikita natin dito, 'di ba? Ito yung symbol natin sa UTI. This is used for UTI ng mga patients, no? Pero there are lots of issues about this because some other countries reported increased resistance with these medications, your TMP and your SMX. Not only for UTI, it could also be used for ito yung, di ba, sa natin, sa prostatitis. So, ito rin, drug of choice din for prostatitis natin. Yes, prostatitis, we have also UTI. That's our, nakapink ito na team, di ba? So, meaning, this is for our gram-negative na spectrum for UTI and prostatitis for our TMP, SMX. So, it's also good for gram-negative, no? Gram-positive. That's why we have here a purple na theme that's commonly used for treatment of MRSA. No mercy. Ito po yung symbol natin sa MRSA, methicillin-resistant Staphylococcus aureus. At saka sa nocardiosis natin, nocardia. That's why it's colored like this because it's acid-fast, di ba? Remember? Acid-fast na gram-positive bacteria natin. So, eventually here, again, positive and our gram negative here, gram positive, gram negative. So UTI, prostatitis, MRSA, nocardiosis. Not only that, it is also used for treatment of immunocompromised kasi may cane. At saka immunocompromised, di ba, alam naman natin, di ba, commonly yung mga AIDS patient natin, PCP, yung ping-pong natin dyan, that would represent pneumocystis carinii pneumonia. So, other than that, tatandaan natin na pag magbigay tayo ng TMP SMX, ito may 200 sa mga may 200, 'di ba? This would remind us about the CD4 T cell count of patients with HIV. So, pag nag-less than na dyan na tayo magbibigay ng prophylaxis against PCP, no? If the CD4 count is less than 200. Yes, prophylaxis against that. So, dito naman sa setting na ito, so meron tayo naka-pyramid, di ba, na hat that would ask about pyrimethamine, and we have colored, ito, di ba, ito yung mga eggs natin na may sulfa, kanina sulfamethoxazole, ito naka-dyed ito, di ba, may colored na mga eggs. So this is our sulfadiazine. Again, pyrimethamine sulfadiazine is used for treatment of ito. Yung pusa natin, toxoplasmosis, di ba? Yes, that's toxoplasmosis. So for toxoplasmosis infection, bigay natin pyrimethamine sulfadiazine. By the way, TMP and SMX is also used for treatment of toxoplasmosis and possibly for prophylaxis. Dito, prophylaxis for toxoplasmosis, sabi niya 100, di ba? For CD4 T cell count of less than 100, we give our TMP-SMX for toxoplasmosis prophylaxis. Okay, for prophylaxis. So, mga side effects natin for these medications, pancytopenia. So, we have here empty pants, di ba? Mga empty pants natin dito, walang mga laman. So that would remind us about. And we have here our megaloblastic na fireworks, di ba? Megaloblastic anemia, no? So, megaloblastic anemia at saka pancytopenia is one of the side effects of this TMP, SMX, pyrimethamine, and sulfadiazine. Okay? So, other than that, we have also here, eto, one of the side effects din ito. Kung titingnan mo, itong devil na ito, reddish na lahat. So, that means rashes, eto, fever, grabing diaphoretic niya, di ba? So, fever, rashes, Stevens-Johnson syndrome, ito, may sloughing off of the mask, di ba? So, that would remind us about Stevens-Johnson syndrome. And look at this. This is bite, diba? May kagat. So that is our bite cells and may mga Heinz bodies. Diba? Heinz bodies. So this would remind us about G6PD deficiency. So in G6PD deficiency patients, this is not given because this could lead to further hemolytic anemia, leading to this hemolysis anemia for these patients na may G6PD deficiency. So again, side effects, you have Stevens-Johnson syndrome, fever, and rashes. Then this could lead to bite cells, hemolytic anemia for G6PD deficiency. Other than that, meron tayo ditong doktor that would remind us about the renal tubular necrosis, diba? Ito mga tubes na yun. So one of the side effects, apat, diba? Apat. So, type 4 renal tubular necrosis. Apat na tubes yan. Type 4 renal tubular necrosis at saka naka-letter K yan. So, that would remind us that one of the side effects is hyperkalemia. Hyperkalemia, renal tubular necrosis. Okay? So, other than that, ito, wolf pala ito, systemic lupus erythematosus. That is also, one of the side effects is why it's also contraindicated to patients with SLE. So other than that, photosensitivity, may naka-photo shoot dito, diba? Photosensitivity is one of the side effects of these medications. Then we have also here photos that is dropped off from the album. So meaning these medications, TMP, SMX, pyrimethamine, and sulfadiazine leads to the displacement of our medications, other medications, for example, warfarin from the albumin. So meaning the warfarin will not be hold, or it will not be binded with albumin. So that's why its effect will be on the tissues, leading to kung titingnan naka-bleed siya, diba? So meaning this would further lead to bleeding tendencies and prolongation of our bleeding time brought about by that clotting factors which is in effect with our deficiency of our coagulation factors related to this matter. So we have also here yellow kernels, kernicterus, leading to, diba? Yes, this medication could lead to kernicterus to newborn because of that effect in the bilirubin. So other than that, we have here, ito yung sa microscopy natin for interstitial nephritis, no? One of the side effects kasi ng medication is interstitial nephritis. Ito, kidneys, tapos blue. So, yan. Would remind us about interstitial nephritis. Again, mga side effects natin, interstitial nephritis, photosensitivity, meron tayo ditong displacement of medications from the albumin. That's why there is more bleeding here. Kernicterus, meron tayo ditong type 4 renal tubular necrosis at saka hyperkalemia, meron tayong Stevens-Johnson syndrome, rashes, fever, G6PD deficiency patients with hemolytic anemia, bite cells, at saka Heinz bodies for G6PD deficiency. Then other than that, we have here systemic lupus erythematosus. Okay, and remember also here we have CYP450 and sira siya, diba? So meaning these medications inhibits CYP450. Inhibits CY450. And ang tula natin that would remind us that these medications contraindicated for patients who are pregnant in the first trimester of pregnancy because again, these are teratogenic to the babies that could lead to congenital malformations. So, yan lang po about TMP, SMX, and pyrimethamine, sulfadiazine for our pharmacology. Thank you for listening. Hanggang sa susunod. Maraming salamat. Po.